Hydrocodone acetaminophen, also known as Loratab or Norco, is a narcotic analgesic. It's also an opiate. So it's given for pain and for cough suppression. Sedation and CNS depression are some of the reactions side effects that you're going to see. You want to make sure that you're monitoring pain relief and using the appropriate pain scale. It can cause respiratory depression, decreased blood pressure, physical dependence, and addiction. Don't abrupt discontinuation with prolonged use may cause a withdrawal reaction, and you don't want to exceed the minimum dose of acetaminophen, which is 4,000 milligrams. According to Lenny, hydrocodone has an analgesic action equivalent to those of codeine. The drug is taken orally to relieve pain and to suppress cough. The usual dosage is 5 milligrams, and it can be contained with acetaminophen. Now, Davis is going to give us some more information. If I can find it. So, the action is to bind to opiate receptors in the CNS and to alter perception of and response to painful stimuli while producing generalized CNS depression. It also suppresses the cough reflex via the direct central action. You'll see confusion, dizziness, sedation, euphoria, unusual dreams, blurred visions, dilopia, meiosis, respiratory depression, hypotension, constipation, dyspepsia, nausea, urinary retention. You can develop tolerance and dependence on this medication. It's given PO. It peaks in about 30 minutes to an hour, and it lasts about 4 to 6 hours. You have to use extreme caution in patients receiving MAO inhibitors, and you don't want to use within 14 days of that. Remember that anything like alcohol, antihistamines, sedative, or hypnotics are going to add to the CNS depression. So for nursing implications, you're going to assess their blood pressure, their pulse, respirations before and empirically during administration. If respiratory rate is below 10 per minute, assess the level of sedation. Physical stimulation may be sufficient to prevent hypoventilation, and the dose will need to be decreased by 25 to 50%. Initial drowsiness will diminish after continued use. You also want to assess their bowel function routinely. Prevention of constipation should be instituted. You could use intake of fluids and bulks and laxatives. Stimulant laxatives should be administered routinely if opioid use exceeds 2 to 3 days. Pain, you're assessing their pain prior to and at 1 hour peak following administration. You also the patient family teaching, advise the patient to take medications as directed, instruct the patient on how and when to ask to take pain medication, tell them that there is an abuse potential, may cause drowsiness or dizziness, advise patient to call for assistance when ambulating. You want to be careful driving, change position slowly due to orthostatic hypotension, avoid the concurrent use of alcohol or CNS depressants, and aggressively combat constipation. Encourage patients to turn, cough, and breathe deep every 2 hours to prevent their lungs from collapsing. You want to use good oral hygiene, and frequent mouth washes, and sugarless gum or candy may decrease the dry mouth.